and welcome to the LPN to the RN Bridge course and the orientation to the virtual clinical excursions, the VCEs, which are part of your assignments for this course. You will have all received an email with your username and password for this Evolve website. Once you get your username and website, you're going to log in. And you're going to come to your Evolve website. From here, you're going to click on the course ID number whenever has been issued to you. This may not be the corresponding one, but this is the sample one that I'm using for this demonstration. You will be using these VCEs in two ways. You will have VCE assignments, and then you will be using the VCEs for your nursing care plans, both 1 and 2. So first, let me explain how you will be using the VCEs for your assignments. On the left-hand side here, you can see you have the simulations VCE. And then there will be an online workbook. Okay, this workbook corresponds exactly to your hard copy workbook that you purchased for the course. In addition, there is the online virtual hospital. Here, when you click on this, this corresponds with the directions in the online workbook. Okay, so I'm going to open this up. And you're going to enter your first and last name, and it's always medical surgical. And the period of care is going to correspond to the assignment that you are doing. So with each assignment, look at what period of care you should be in and select accordingly. So here I'm just going to start with the period of care 1. And I'm going to go to Start. And that brings me to the list of patients in the virtual clinical excursions. There are 6 patients that you will become very familiar with during the course of the assignments. So here I have 6 patients. I can click on one and I can get report, or I can go directly to the nurse's station. Well, I have to select a patient. So let me select Harry George and I'll go to the nurse's station. The nurse's station is very typical of what we might see in a virtual hospital. To the lower left here, you have a lab guide, you have a drug guide. If we continue on, you see the medication room, and then all of the rooms are corresponding to the patient. If you want to exit, you would leave the floor. Up above, again, we have a patient list, so Harry George, I'm going to get some report, and here is your report. I can return to the patient list to get another patient if that's what I need according to the assignments. Now I have returned to the nurse's station, and as you can see, I'm going to go to the Cardex. When you go to the Cardex, it always defaults to room 401, which is Harry George. So if you need to go to another patient, such as Pia Jordan, you would need to click on that corresponding room number. As you can see in the Cardex, you see the medical diagnoses, problems and outcomes, the dates, admission information, allergies, pain, elimination, primary team, respiratory assessments, etc. Now I'm going to circle back up. And to leave the Cardex, then I'm just going to go back to return to nurse's station. And again, scroll up, and you will see the chart. And again, let's say I want patient Clarence Jones, his chart. Here on the right-hand side, you have allergies, physician orders, nurse's notes, all the way across. So whatever the assignments and the VCE workbooks will tell you exactly what you need to get that assignment completed. Here is the MAR for George. And again, always scroll down to get all of the information that you may need for that assignment. Once you have obtained all the answered all the questions for the assignment, for the VCE assignments, you will put that in a Word document and then submit it according to the directions in Blackboard. Now, the second part that you will be using the VCEs for is your nursing care plans. Everybody will be assigned a patient for the Nursing Care Plan 1 and Nursing Care Plan 2. So for this one, if I go to 402, if I was assigned Jackie, it's not going to give me all of the information that I need. So I really do need to start over. I need to leave the floor, and I actually need to restart the program. Because here, what I need to do for your nursing care plans, you're going to do the same thing. Put in your first and last name, click medical surgical floor, but here you're going to need period of care 4, because this gives you all the information that you will need for all of the times. Here, then you click Start. And now you go to the patient list that you are assigned. And if you were assigned Pablo Rodriguez, so I have the patient Pablo Rodriguez, and I'm looking at the clinical report. Big thing here is, as you see, you need to scroll down and get all of the information. This is important as you go on, as you see the chart. We're going to go back to so now we are in the acute care cardex for Pablo Rodriguez. Again, you want to make sure that you scroll down and you get all of the information necessary for your nursing care plan in this area. I'm going to return to the nurses station. Click on the MAR. This is Harry George, so I need to find Pablo Rodriguez. So if I click on the chart for Pablo Rodriguez, I'm going to look at physician orders. And as you can see, I can scroll down, and I would scroll down here and look at all of his orders to date. And this is where I would find anything that was pertinent to Pablo. I'd also look at lab reports. Now, the important part about lab reports is that I can scroll down and look at them, okay, as you can see. But the other important part when you're getting data for your nursing care plan is also to make sure that you're scrolling down. If there is more data, not only up and down, but to the right and left. And here it doesn't show it, but there are areas that you will need to do that in getting all of the data for your nursing care. So here is your information about your history and physical. Okay, again, scrolling down to get all of the pertinent information that you may need. Remember, expired MARs have important information that you will need for your nursing care plans. Consents, admissions, mental health, all of those you need to go through all of these sections to make sure that you get all the information that you need to have a comprehensive nursing care plan. The last part I want to talk about is the student resources. So if we go to student resources, here is getting started, how to set it up, watching the VCE guided tour, the quick tour, the detailed tour. These are the things that you don't have to worry about reducing medication errors, but this will give you a nice overall orientation to how to use the VCEs in general. Well, that should do it for the orientation to the VCEs. Certainly, if you have any questions, please contact the faculty, and we're happy to help. Best of luck, and we look forward to working with you in the LPN to RN Bridge program.